And welcome back to All Business Media TV. I'm your host, Rick Delgado, and joining us once again here on the show is our very good friend, Dr. Scot Bay. He's the host of Psychiatry Today, weekly radio show, which you can hear nationally on AM All Business Media, where you can check that out live. You can also go to his website, nfbhc.com, to find out more about him, what he does, how he can help you, or reach out to him by phone at 678-822-0250. Dr. Scot, welcome back, and how are you?
I'm doing great, thanks. It's great to be back, Rick.
Yeah, it's good to have you back. Now, I know we've done a bunch together. We've done some TV. We've done a bunch of radio together. We do Psychiatry Today, your weekly show every week on the air. But for the people that don't know who you are and have never, heard from you before, tell everybody a little bit about yourself and exactly what you do. Right.
Well, my name is Dr. Scot Bay. I have a full-time private practice located in Roswell, Georgia. And as far as the Psychiatry Today show, as it were, the main format is our weekly radio show every Wednesday at 12. And then there's also the Psychiatry Today podcast. And these shows that we're doing now live, the main purpose that I have, other than treating patients in my office, is to try to promote better general knowledge about mental health issues.
Right.
I want people to have better information about feeling well mentally and emotionally. What I've observed over the course of my career is there's so many myths and misconceptions and misunderstandings and stereotypes and prejudices, unfortunately, that people have about mental illness and mental health issues.
Right.
And it's a primary goal of mine to clear up a lot of those myths and misconceptions, try to reduce the stigma associated with having a mental health problem, needing help for it, promoting more and better knowledge among the general public about what it is that we do in psychiatry and what is going on when someone is suffering from a mental health problem and how they can best get help. The other thing, unfortunately, I've been getting a lot of feedback over the course of my career from patients that other people they've seen have really not been able to get them the help that they've needed.
Right.
So another reason for our Psychiatry Today franchise, as it were, is to try to help people who maybe have had mental health problems, tried to get help elsewhere in the past, but have had trouble.
Right. Yeah, and again, we're going to be taking live phone calls here today on the show. So if people want to reach out to us, of course, you can ask Dr. Scot any question that you have, just like the radio show, too. You don't have to use your real name. You don't even have to use a name. If you just have a general question, or you got a general question maybe about somebody that you know that's part of your family and you're not sure how to approach it, you can leave the name out. It doesn't matter. You can reach us here in studio at 516-629-3715. And again, I think a lot of what you do, Dr. Scot, and it's taught me a lot, because let's face it, I'm a product of my environment. I watch a lot of TV, a lot of movies. That's where I get most of my information from. Not great for me to admit that, by the way. But it's the fact that people have these misconceptions. It's what you see. It's like, oh, well, I saw One Flew Over the Cuckoo's Nest. Everybody's crazy like that, right? But it's not like that.
Right.
And there's a lot of changes ever since, I want to say probably from the 80s on, it's when there's been a lot more changes, I think, to mental health.
Yeah, there have been a lot of changes, you're right. And I do feel like you're saying the media have done a lot to promote and perpetuate a lot of negative stereotypes about mental health issues, not just movies and television and things like that, but when there are problems that happen in the world and it makes the news that someone who is involved has had a mental health history, that gets a lot of distortion and misinformation surrounded by it. For example, what comes to my mind along those lines is all the very, very severe and unfortunate incidents of violence, whether it's school shootings or other shootings, things like that. A lot of focus on mental health problems there. But just to take one example like that, clearing up the myth there is that someone who has a mental health problem is far more likely to be the victim of violence than to commit any act of violence.
Really?
So, right, exactly. And this is just, one example of the type of thing that, people have these ideas and don't really know what the truth is.
Right. Now, is that because, and I think I see where you're going with that, because I think that's something that's portrayed in TV and films as well. You know, where you'll see somebody who maybe they're homeless and they're going through an alley or something, and they're kind of doing something strange, and you're kind of looking at, normally you'd kind of back away and be like, what's wrong with this person? But that person kind of opens them up to violence. So that's what you're saying. You've seen that.
Exactly, but they needn't be in such vulnerable state such as what you described to also be a victim of violence, because someone who has a mental health problem inherently is vulnerable and prone to be taken advantage of, not able to advocate for themselves, not able to muster the resources it takes to be able to support themselves and stand up to themselves in the face of being taken advantage of in any number of forms.
Right. Would that include even family? Because, I'm sure that and we've probably seen a lot of examples of that, in the news as well, as that, family people, people in families are kind of taking advantage of the person in their family that they know they can, that might be suffering from something.
It's ugly to contemplate it and talk about it, but unfortunately you're right. It does happen within families. And that is an unfortunate reality. Another area of recent concern is all the abuse that young people have suffered. For example, the gymnasts, right? So, that's caused a lot of mental health problems. But it is also pointed out in the aftermath of all the news about that, there was a study where people who have special needs for one reason or another, perhaps autism, perhaps mental retardation. An alarming study came out. These folks are tremendously taken advantage of as far as sexual abuse and exploitation.
Right. Yeah.
So, just the idea that mental health people with mental health problems rather are vulnerable and taken advantage of. That's just one of many things that people don't really know or understand enough about. A lot of the messages about mental health issues and mental illness are distorted in the media, and that is one of my causes to try to counteract that and clear that up and clear up a lot of that misinformation.
Yeah, so if you do have a question for Dr. Scott today, give us a call here. We do have a caller on the line right now. Let's go to him. John in New York, you've got a question for Dr. Scott.
Yeah, hi. Thank you so much for taking my call. Dr. Scott, I'm sure you're aware of what happened in Florida with the shooter, and just the other day they caught the Austin bomber, and he killed himself. Are these people examples of people suffering from a psychotic break?
Right. Well, thanks very much for your call and listening, John. When it comes to the shooter in Florida, I don't recall any news about him having any psychotic symptoms. And as far as the other incident that you mentioned,
the Austin, Texas bomber, that was just
right. See, at least in the case of the Florida shooter, we do know that he had a history of mental health problems, was treated, and his treatment lapsed when he lost his mother and moved in with another family. And there were also missed opportunities to get him to a place where he could not commit acts of violence when the authorities tried to mandate him into mental health treatment, and for some reason the system failed, and that didn't happen. As far as the bomber in Austin, from what I've heard so far, unless there are new developments that I haven't seen in the news yet, there was really not anything about him on the radar as far as any law enforcement issues. It wasn't one of those situations where, oh, well, yeah, we had contact with him. The FBI had interviewed
multiple
him,
tips and stuff like that.
Neighbors and friends, oh yeah, we knew he was always going to be. It's always so discouraging to hear these things after one of these incidents. Did not seem to be the case with him. And he was not on the radar of law enforcement. He was not on the radar of mental health professionals. So it's really, really hard to tell. There was that manifesto that he left on his cell phone, the 25-minute video that he recorded on his cell phone that law enforcement have seen, but since the investigation is ongoing, we have not seen that yet. We don't know more of the details. But John, if you're still with us, or regardless, I think as far as your particular question, when I think about one of these incidents and someone who's had a psychotic break, and psychosis meaning just complete loss of reality, delusional thoughts, irrational thoughts, what comes to mind is the Aurora, Colorado movie theater shooting that was 2012, 2013. He was someone who definitely had psychotic illness and was actively psychotic during the whole episode, in which he dressed up in all kinds of tactical gear and broke into an opening midnight showing of the latest Batman film, and just indiscriminately sprayed the movie theater with automatic weapon fire. He was in the throes of psychosis, and the tragedy there is that his psychiatrist at the graduate school where he was a student reported him as someone who was a threat to others to the campus police. It was then their job to report that to the local Aurora, Colorado police, or whatever jurisdiction that would have been. That didn't happen. And I'm the first one to admit, can law enforcement go knock on the door of everyone who someone might report, say, hey, you know, I'm afraid this person might be doing something? Obviously, that's not realistic. But if a psychiatrist, a mental health professional, has that much concern, they're going to breach patient confidentiality enough to reach out to some law enforcement agency to do that. You know, my feeling on that, it's so tragic. Would it have killed the local authorities to just knock on the door? They would have found all that stuff he had in his apartment. Maybe it wouldn't have happened. But bottom line for your call and your question, John, while it certainly has happened, there is some history that some people who have had a psychotic break have acted out violently. I have to say it's the exception. Usually someone who is that bad off in a mental state is not capable of organizing, committing a crime like that in terms of the thought, the planning, the materials, everything else.
All right. Well, John, thank you for your call. We appreciate it. And to follow up a little bit on the on that question of the psychotic break, can that happen to anybody? And are there any warning signs? Like if somebody, you know, just the normal course of day, can something just like trigger something where all of a sudden it's like out of nowhere? They've never had any symptoms. They've never had, you know, no one's ever, you know, wondered like, is there something wrong with Mary over there or something like that? You know what I mean?
The short answer to that is yes, Rick.
Really?
Anyone can be vulnerable to a psychotic break. However, there would usually be several other factors that would make it more likely. For example, usually if someone has that happen to them, there's some kind of genetic predisposition. It's rare that someone who has that happen to them doesn't have some sort of family history of mental health problems. When you look at any kind of psychiatric or mental health problem, they're almost always genetically transmitted. There are some mental health problems you can track right through a family tree. Bipolar disorder, there are elaborate family trees you can draw showing all the genetic connections. Alcoholism, that usually tracks right through the males in a family tree, granddad, dad, grandson. Attention deficit hyperactivity disorder also very, very strongly runs in families. So as far as a psychotic break, one factor that almost always would need to be there would be genetic predisposition. Other factors include, let's say, alcohol or drug abuse. That could make someone more vulnerable. Just severe, overwhelming stress combined with the genetic vulnerability. And last but not least, very severe certain medical problems. It's a rare thing, but let's say cerebral vasculitis, a severe inflammation in the brain, a tumor, things like that. So those are the things that could contribute.
Okay, no problem.
We have another.
That's good to know because I don't think a lot of people realize that that's a possibility. We do have another caller on the line. I believe the caller's name is Winston from Massachusetts. Winston, are you there?
Yes, how are you?
Good, how are you? And what's your question for Dr. Scot Bay?
Hey, so my mom just told me and my family that she's being treated for depression and she's on Zoloft. Is there anything we should look out for when it comes to her taking this medication, like mood swings or something like that, any other side effects?
Right. Well, thanks for listening to the show, and thanks for your call, Winston. So really, I think as far as what you and your family should be on the lookout for your mom is hopefully she'll be feeling better as far as getting back to her normal self, right? So the goal of the medication is for her to get back to her usual self, be able to enjoy things the way she normally did, to be able to have interactions with all of you the way she normally would. My guess is if she's been going through depression, then you and the rest of your family have probably been noticing that she has not been herself lately, kind of withdrawn from everyone, not as talkative perhaps, maybe sluggish, lethargic, unmotivated, not able to enjoy or get interested in things. So one thing you should be looking for is all of that coming back, her getting back to being your mom as you knew her.
Right.
As far as what to look out in a negative way, I mean, of course that's important, but Zoloft, like most newer generation antidepressants, is very safe, very effective. At worst, it might upset her stomach a little bit in the very beginning, but that usually goes away in about a week. Rarely it will make someone tired physically, if that is the case, but it's also helping her mood. It's pretty simple to counteract the tiredness by having her take it in the evening and not in the morning. That way it's less apt to make her tired during the day. But as far as to be concerned or worried that the medicine is going to affect her mood and her mental well-being in some kind of negative way, I want to reassure you that would be the rare exception. Unfortunately, a lot of what you read and hear about when people are talking about, oh, well, what do these medicines that are used to treat depression and anxiety do? Are they good for you? Are they bad for you? Do they do bad things? Unfortunately, this is what I talk about all the time, the myths, the misconceptions, the misunderstandings. The medicines are very safe, very effective. They help people heal. They can be life-saving when someone is so depressed that they're suicidal. So really, it's the rare exception that they would have any strange or undesired effect on someone's mood or thinking or behavior, which is not to say that never happens. Unfortunately, sometimes it does, but I want to reassure you and the rest of your family that's the rare exception. However, if there was anything untoward that was going on, let's say instead of your mom being more like her usual self, you saw her diverting even more from her usual self than she was when she was depressed, then it's time to say, okay, let's let the doctor know maybe it's time to try some other medicine.
Right.
But bottom line is, no, if she has a problem with depression, she's on medicine, she's getting help for it, that's good news, and I think she should be feeling better with that. And one last thing I want to leave you with, a very large study in the early to mid-2000s done at a major university in Europe. They asked about almost 40,000 people who had tried every single antidepressant on the market, which one helped you feel the best, and which one had the least side effects. Zoloft and Lexapro were tied for first place. So with all that, I want to reassure you, I think it's good your mom's on this medicine, and she should look forward to feeling better, and you and your family should look forward to having your mom back as she was real soon.
All right. Well, Winston, thank you for your call. Hopefully that was helpful.
Yeah, thank you very much, doctor.
You're welcome.
All right, you're very welcome.
All
Yeah,
right.
and again, when you hear, Zoloft, the first thing that comes to my mind, Doc, is Mike Tyson, because he made that famous statement, "I'm on Zoloft to keep me from killing y'all." So it's like one of those things where it's like it has this kind of stigma attached to it, I think, because people think, oh, well, Mike Tyson's on that. That must be really strong because he's not right, he's in the not right club.
That's just, again, one of the things that perpetuates a lot of negative myths and misunderstandings and stereotypes. And it isn't just that. There was also a famous case in South Carolina, I believe, if I'm not mistaken, many years ago, where a very young man, I think he was a juvenile, if I'm not mistaken, killed his grandparents, and his defense attorney wanted to blame it on the Zoloft he was taking, right? And then you also have the late-night infomercials with lawyers who want to gather up patients for a class action lawsuit. If you took Zoloft and you were pregnant or whatever their pitch is. So, it is unfortunate that there are these very, inappropriate, negative messages that are in the media.
Right.
I will say this, though, getting back to your point about Mike Tyson, and would it be scary for anyone to know that they took it, after knowing those comments? I would say no, because the interesting thing, if I think about all the antidepressants and thinking about what I've had the most success with treating, fairly young to middle-aged men who had problems with their mood, but especially anger problems, and maybe on top of that, they also potentially could have substance abuse problems, plus or minus that. I would have to say I had the most success with Zoloft. So my guess is it was probably a good choice for him and probably helped him.
Right. Yeah. And he hasn't killed anybody, so that's another plus.
Well,
let me ask you this real quick, Dr. Scott, before we get to our next call. Is there a certain amount of time, like a prescription time, where you should only be on it for a certain amount of time in treatment before you take a break from it, or is that something where? Because I think you mentioned some of these things that end up getting prescribed. You're on it for the long haul.
Right. Exactly. So the time frame of taking the medicine, there are different situations that would dictate that. If you have one lifetime episode, you never had a problem before, it was clear what caused it, and like a bereavement, loss of job, something like that, you were perfectly fine before that, never committed, rather attempted suicide, there weren't family members who committed suicide, all things that would indicate a risk of recurrence or relapse, then you get someone feeling well after a year, you taper them off and stop it. All of the textbooks would say that.
All right.
If, however, someone had a serious episode, including a suicide attempt, a serious attempt on their life, strong family history of people who had attempted or committed suicide, it's probably better to keep that person on the medicine longer to prevent recurrences.
Right.
The other thing is if it's a new onset illness, but in an elderly person, those demographics are more vulnerable to relapse. So in that case, it's probably better to leave them on it once they're feeling well so they don't have a recurrence.
Okay, well, that's good to know. Again, we are here with our guest, Dr. Scot Bay. He's the host of Psychiatry Today. You can reach out to him through his website, nfbhc.com, or call him directly. If this is something that maybe you've got some questions on, you're not able to join us here live today, you can reach out to him directly, 678-822-0250. And again, if you are going to call on one of our lines right now, feel free, 516-629-3715. You don't have to use your real name. You don't have to use a name. If you just got a general question, you want to get it out there, and you've got some concerns regarding yourself or family members, you don't have to use any name whatsoever. You can just, ask Dr. Scott your question, and he'll be more than happy to answer it for you. Let me ask you this. Now, when you are dealing with somebody who maybe is, they're getting to the end of that term of where you think, okay, you know what, I can start weaning this person off. Is that a difficult transition for them? Or are they going to be, you know how some people kind of grasp onto it? No, I need this because I can't survive without it kind of thing.
Well, personally, I think that if someone is that anxious about the idea of coming off their medication, there's no rush to do it. There are minimum periods of time that you keep someone on their medication to make sure they don't suffer a relapse.
Right.
But there's no maximum. Someone could make the decision that, hey, I'm feeling so much better, I don't ever want to take the chance on going back where I was. Well, the good news for that person is they don't ever have to come off their medication.
Okay.
Because really, there is always the chance there's going to be a relapse no matter which one of those circumstances we were talking about.
Right.
So if someone just makes a decision along with their doctor, and I would certainly support that too, you know what, I like how I'm feeling now, I don't ever want to go back to where I was, so I'll just stay on it, that's fine. And some people do make that decision.
All right, well, that's good to know as well. We do have our next caller for you, Dr. Scott. It's a gentleman by the name of Richie. He's from Long Island. Richie, what's your question for Dr. Scot Bay?
Hey, doctor, how are you?
I'm great, Richie. How are you doing?
I'm doing well, thank you. My question is, when it comes to medication, how do you feel about the use of natural medicine like St. John's wort, since that's a big thing in Europe for treatment of depression? I just wanted to know your input on that.
Right. Well, two parts to your question, Richie. Natural medicine in general definitely has its place. I see it as complementing prescription medication, not taking the place of it, right? In other words, there are several things that we know help with depression, but when someone has a very serious medical problem, they have extreme clinical depression or major depression as the medical name for the diagnosis is, they do need prescription medication to recover their functioning, to help their brain heal. Depression is a very serious chemical imbalance, hormonal imbalance in the brain, and there's nothing natural that can take the place of the effect of prescription medication to help the brain heal. An excess of stress hormones is what causes depression, and that will make someone have this hormonal imbalance that affects their mood and behavior in a very negative way. So prescription medication is needed to restore things to the proper balance. Having said that, we know there are several natural things that complement what antidepressants do. For example, L-methylfolate, which is a special form of folic acid. Some people genetically aren't able to metabolize that, so supplementing that will help. SAMe can help with depression. Vitamin D, if people are low in vitamin D, that can make them depressed. And fish oil, omega-3 fatty acids. So those are the things that we know have strong evidence that help with depression, that are natural and are not prescription. The St. John's wort, Richie, I got to tell you about, even though I know it's very popular in Europe, I need to just tell you some things about that. In Europe, in general, and especially in Germany, they openly advocate prescribing of placebos. It is absolutely out in the open. Doctors willingly and knowingly prescribe placebos. Patients know they're getting placebos. And I know this sounds surprising, if not shocking. Here in the United States, that would never fly. A doctor would be accused of committing fraud, would be reported to the medical board, would be potentially arrested for fraud. But nonetheless, this is what goes on in Europe. The fact about St. John's wort is it really doesn't work. The National Institutes of Health, which is our government health research agency, it's independent, has no influence from pharmaceutical companies or politicians or anything like that. It's just pure scientists. They desperately tried to get St. John's wort to work in depression years ago. They couldn't get it to work. This was back in the 80s or 90s. The bottom line is, for true major depression, it's not enough to do anything. And besides the fact that it doesn't really help someone who's seriously ill with depression, the other very detrimental parts of St. John's wort, it has a long list of very serious adverse interactions with many prescription and over-the-counter medications. So someone could just buy it in the store and take it, not knowing that it could literally be toxic in combination with their other prescription or their other over-the-counter medication. And they wouldn't know that, and they could be putting themselves at serious risk for complications. So bottom line, Richie, there are some safe and appropriate natural things that help with depression that complement prescription medications for depression. But unfortunately, I have to say, St. John's wort, not one of them. Don't recommend it. Recommend avoiding it. So thanks very much for your call. Appreciate it.
Thank you for that. That's a great answer. Thank you very much.
Okay, you're very welcome.
And again, thank you for your call, Richie. Richie calling in from Long Island for Dr. Scott. That we have for today. You can reach out to us here in studio again if you'd like. 516-629-3715. If you got any question for Dr. Scott, we're also doing this on Facebook Live. Our first foray into that. So we'll we're enjoying a little bit of that as well. So if anybody's watching us there, feel free and reach out. Now let me ask you this, because I know a lot of people are making that move, Doc. They want to stay away from medications. They want to do more holistic. They want to do more healthy, natural stuff. Is it something where you've seen, because you mentioned vitamin D, and we know what just happened the other day. It's the first day of spring, and all of a sudden the clocks move, and I myself, I'll admit it, when there's more daylight, I feel better.
That's exactly right.
I'm happy.
Yes.
Are there other things like exercise that people can do, or other natural things that can help enhance if they are on medication?
Yes, absolutely. I want to expand on your point about sunlight. Right? We just turned the clocks back. Turn the clocks ahead back into daylight savings time a couple of Sundays ago, and we have longer days, we have more sunlight. Sunlight is an antidepressant, so that's definitely a big help. Exercise, regular exercise, I'm a strong advocate of that, should be on a daily basis. It helps with mood. It helps with thinking and memory. You know, I believe in it very, very strongly. It should be part of your daily routine, part of personal hygiene, taking care of the body.
Right.
Makes a big difference. And there's also a lot of research to show that other allied techniques like mindfulness meditation help with mood and help relieve depression, anxiety, and stress. Yoga, especially yoga that incorporates a mindfulness component to it, also has been studied. And I'm talking about legitimate studies, not just people who think and talk and write about it. I'm talking about major universities where they do actual medical research that's published in peer-reviewed medical journals, prestigious ones like the Journal of the American Medical Association, like the New England Journal of Medicine. So yoga and mindfulness meditation are the real deal as far as helping with anxiety and depression, along with other treatments, psychotherapy, medication, certain select specific supplements, you know, exercise, meditation, yoga. To me, that's what I consider a holistic approach, meaning comprehensive, as opposed to some people use the term holistic to describe just natural, non-chemical, non-medication. But to me, that should refer to doing all these things we just talked about, a comprehensive, thorough approach to feeling well and relieving symptoms.
Right. Yeah, because it does elevate your mood when you're out and about and you're moving and you're seeing people, right?
Absolutely.
And that can definitely help, especially, you know, what would you say to the person who, you know, my mom's a victim of this. I mean, she's retired now a few years, so now she doesn't get out as often, and, you know, she kind of just hangs out, and it's like, how do people like that in that position fend off, you know, fighting depression? Because that can be tough.
You're right. It's very difficult. And in fact, it's interesting that you say that, because it makes me think of, okay, social isolation.
Right.
We know that being socially active is something that prevents or delays the onset of dementia. In fact, you know, you can take all the supplements and all the computer games and puzzles and all that. The only things there's hard evidence for preventing dementia is regular exercise and regular social activity. Right. And, you know, those have robust data for them. So, but the social isolation and withdrawal can also aggravate depression. So it is better if she can be encouraged to be out and around people more often, and that definitely would help with mood.
Right. No question. What about nutrition? How important is that too to the equation?
A good diet is also very important. You know, the expression garbage in, garbage out. So the opposite follows. If you're eating well, if you're eating a good, healthy diet, you're going to feel well mentally too, not just physically. Right. Very important.
All right.
So,
well, that's good to know. We've got another caller on the line, so why don't we go to that caller? Calling in from New Jersey is Anthony. Anthony, welcome to the show, and what's your question for Dr. Scot Bay?
Hey, how's it going, Scott? All right, so when it comes to like, you know, when it comes to medical issues, now, is mental issues, can that be hereditary? Now, is that true? Because I've heard it before.
Yes, absolutely, Anthony, yes. Mental health issues can very often, in fact, most often are hereditary. We were talking about that before. Right. There are lots of examples of this. For example, I would say the one major psychiatric syndrome that is most obviously genetically transmitted is bipolar disorder. For decades now, geneticists have been able to take family trees and track the incidence of bipolar disorder among a group of related people. And I myself have observed in my own private practice, I've been doing that for more than 25 years, strong genetic connections, alcoholism that goes right through the males, especially in a family tree. We were talking about that before. Right. And attention deficit hyperactivity disorders, that runs very strongly in families. So yes, absolutely. In most cases, in fact, it's hereditary. I would actually say it's the exception when someone has a mental health problem and you cannot point to some fairly close relatives with similar issues. Right.
Right. All right. All right. Thank you so much.
Thank you very much for calling, Anthony. Thanks for your question.
Absolutely.
Yeah, Anthony.
Have a good night, guys.
Yeah, you too. And again, thank you for your call. We appreciate it. Real quick, and following up with what he was talking about, because you did make mention of the heredity part of it, where it can run through families. Does it ever skip like a generation? You know,
sure, right.
Where someone,
Yes.
you know, because maybe somebody does see it in their family, like heart disease runs in families.
Right.
Is it something where if they think about it too much, they might bring it upon themselves too?
Not so much that,
might trigger it?
But to your point, it does sometimes skip generations. I mean, this isn't 100% that it will happen. It's just, it confers an increased risk when you have a near genetic relative who has a problem that their children will, or their children's children will have it, but it's not 100% that it's going to happen. So certainly it does sometimes skip.
Right.
And you're asking me the question reminds me of, let's say, the alcoholism analogy. Remember, we were talking earlier in the show, and then just now we were answering Anthony's question. I've seen that go through the men in the family tree. So granddad, dad, grandson. Sometimes it'll skip son and just go granddad to grandson.
Right.
And but it's interesting. A lot of times the explanation is dad saw so much of the devastation that granddad's alcoholism caused him and the family that dad swore off alcohol and never drank.
Right.
But nonetheless, things happen in grandson's life that he was exposed to drinking, got addicted to it, and so even though it skipped that generation, it went down through the generations and wound up affecting a descendant. So that's an example of how there is the genetic connection and vulnerability, but for one reason or another, it just skipped that one generation.
Well, in that example, though, he had the father, being affected by it, made a conscious decision. You can't really do that with mental health. Can you make a conscious decision?
No.
I'm never going to be depressed, or I'm not going to be bipolar?
No, you're right. You have to be lucky to not have had a severe series of life stresses happen to combine with the genetic vulnerability to cause the episode to happen.
Now what if, because you mentioned life stresses, now that just makes me think of traumatic events, something that happens, maybe a bad car accident, or you see somebody die, or you know what I mean? Something,
or a death in the family, or a divorce.
Even the guys returning from overseas.
Exactly, certainly.
Military
severe trauma, whether it's military or civilian trauma, or divorce, layoff, bankruptcy, fire, flood, earthquake. It's almost always, when it comes to an episode of mental illness, a combination of genetic predisposition and vulnerability, and on top of that, severe environmental stress. At least the initial first lifetime episode will usually be traceable like that.
Right. Now some of those stresses, say, maybe there is a loss of job, a divorce, and all those, stresses. Are those things that, as a parent, if you're going through those things, should you be paying attention to how your kids are kind of being affected too? Because I mean, I'm sure they're absorbing what they're seeing too, right?
Yes, absolutely. Kids are very sensitive to their parents' emotional state. So yes, absolutely. Parents who are going through difficult times like that need to pay attention to how their children are affected, no question.
All right, well, that's good to know. We've got another caller on the line for Dr. Scot Bay, so let's go to that. JoJo in New York. JoJo, are you there?
Hey, what's going on?
Hey, how are you? And
I'm doing great.
Welcome to the show. And what's your question for Dr. Scott?
Thank you. My question is, I know this actually might sound silly, but it's serious. Can certain people actually make you go nuts?
Well, I appreciate your call and your question.
Okay, JoJo.
And I think what you're saying is, are there people in your life who can cause you so much stress that you start to break down mentally? Is that what you mean?
Absolutely.
Yes. Yes.
Because I do have a lot of people in my life like that, so I'm just trying to see if it connects.
Yes. The short answer to that is yes. And I will expand on that. Believe it or not, this has been studied. When people around you are under a lot of stress, that can cause you to be more stressed. Others' stress, it's almost like it's contagious. And it can affect us. So, and we are exposed to enough of that, and yes, it can start to cause us to suffer mental health problems from all that stress. Furthermore, depression in particular. This has been shown to be contagious, as it were. In other words, if someone is spending a lot of time around others who are clinically and severely depressed, it will start to bring their mood down as well. And then also to cite some other examples. And again, I'm giving you a serious question to a question that you might have been meant somewhat facetiously, but it is true, and it's a really serious issue.
Right.
Another example I can think of is when it comes to caregivers who are caring for someone who has dementia, whether it's Alzheimer's disease or other types of dementia. It has been studied, and research has found that caregivers not only start to suffer from depression from the stress of being a caregiver, they will start to show memory problems.
Really?
Absolutely. Which, that's very scary.
Yeah.
And then also, obesity can be contagious. People who spend a lot of time with a peer group who are obese and tend to overeat and eat impulsively and eat the wrong foods, guess what? They start to gain weight.
Right.
So absolutely, JoJo, the thing is that the mental health issues that others around us have can definitely affect our mental health. The thing to do is to be aware of that, to do the things that we know help our own mental health, take good care of ourselves, pay attention to good personal habits like sleep, like setting time aside for leisure and relaxation, exercise, good diet, things like that. And at the end of the day, when it comes down to relationships that sadly may be toxic to us in a sense, it may be time to try to curtail some of those interactions if they're bringing us down and they're having that much of a negative effect on us.
Yeah. All right.
Absolutely.
So thanks for your call, and I take it to be a serious question. So
No, I do appreciate it. That was very insightful, and a lot of things are definitely starting to make more sense now that you said that.
great. Okay, well, I'm so glad, JoJo. All right, take good
JoJo.
care of yourself.
Yeah.
Thank you. You too.
All right.
And thank you for the call, and thanks for listening and watching.
Yeah.
Hey, let me ask you this, because again, he asked it in a not so serious but a serious question.
Right.
And it's all those relationships that you talk about, because those can be, you're in relationships at work, you're in your personal life relationships, you've got relationships with, peripheral, people that you're maybe just working on one or two little things with, and those can all be, like you said, they can be toxic.
Exactly.
And once that gets into you, sometimes, some people fall into that trap of, this is just the way life is. And that can start you spiraling, right?
Exactly, right. So people have toxic relationships at work, a boss who is abusive and or micromanaging and hypercritical, coworkers who are either the chronic complaining type or the type to shirk work and make everyone else do more,
right.
Or the undermining type to always blame them and throw them under the bus, things like that. And, you have friends who can be toxic in their relationships, always taking advantage, borrowing, taking, never reciprocating, never being supportive when you need someone. And unfortunately, we can also have toxic relationships among our families.
Right.
And this is very difficult and very sad, but the reality is none of us are born into this life with 100% money-back guarantee that we're going to have warm, loving relationships with our parents, our siblings, our aunts, uncles, cousins, what have you. So as sad and as difficult as it might be sometimes, there are times when, as JoJo pointed out, when we realize that we have relationships in our life that are toxic to us in some way, that are having an obvious detrimental effect on our mental health, then it's best to set some limits, withdraw from those relationships, try to scale back and curtail our interactions. And in some very serious worst cases, I know this sounds bad, but there are times when people have no choice but to completely cut someone out of their life if the abuse they're suffering is so extreme from that person.
Now, what about some of those people that, they know they need to get away from this person, but they can't? Is that something where you've come across in some of the people you've worked with, where you've got to kind of help them make that break? And how do you support that?
Exactly, right. Well, when someone okay, let's take your example a couple of different ways. Let's say someone can't because they just don't have the emotional energy or the strength to do so, right? No, so that person I would recommend therapy or counseling, right? Because the point would be to help them gather the emotional strength and personal self-worth and self-esteem to realize how this other person is affecting them and how detrimental that relationship is, and to be able to gather the strength to set limits, if not just cut that relationship off. But then another example to your question might be, let's say someone just doesn't have any way of cutting themselves off from this person. They're just stuck with them being in their life for one reason or another, whether it's a family member, coworker. Then the issue, again, probably therapy or counseling to help coach that person be better able to deal with having that person in their life, or not, as the case may be, to learn how not to let that person affect them in that way.
Okay. Well, that's
easier said than done.
Yeah, well, much easier said than, because some people, you know, they end up being codependent, and you know, they kind of feed off of each other that way.
Exactly, and that demands another type of psychotherapy altogether to treat the codependency.
We've got time for another caller, so let's go to that real quick. Donald from New York. Donald, welcome to the show, and what is your question for Dr. Scot Bay?
Hi, guys. Dr. Scott, just wanted to say I'm a big fan. I love everything that you're doing with the radio shows. You got the, what's that thing called that you do every Wednesday at like 5 o'clock?
The podcast.
Yeah, the podcast. That thing's great.
Thank you so much.
Because, you know, it's just you by yourself. Doctor, let me ask you a quick question though. If I were to have, say, my primary care physician diagnose me, would I, if I needed a diagnosis for a mental problem, could I go to him, or do I have to go see a psychiatrist?
Well, primary care physicians may be able to make a diagnosis like that, Donald, but some are more skilled in it than others. I think if they were to use a specific diagnostic tool, it would help. Primary care physicians usually have much less time to make a mental health diagnosis compared to a psychologist or a psychiatrist. But fortunately, there are diagnostic tools that some primary care physicians use in their practice. And one that comes to mind is the PHQ-9. Some primary care physicians I know have this questionnaire on a pad in their waiting room, and a patient can fill it out and then bring it to the doctor when they come in the room for their visit. It stands for Patient Health Questionnaire 9. There are other kind of quick but accurate tools to self-assess, self-diagnose for depression. There's one called the Beck Depression Inventory, and there are similar scales and things like that can be filled out for anxiety, per se. The GAD-7, Generalized Anxiety Disorder 7, is a brief questionnaire. So I think if the primary care physician were aided by one of these rating scales that the patient can fill out for themselves, so you have some sort of objective number of data to say, oh, well, look, based on this rating scale you filled out, it shows that you're suffering from anxiety and or depression. That would certainly, I think, raise the confidence level of a diagnosis made by a primary care physician. This was studied many years ago. The issue is that I would say more than 80% of all the prescriptions for psychiatric medications are prescribed by non-psychiatric physicians, by primary care physicians, by pediatricians, by OBGYNs. And that's because there's too few of us psychiatrists. It's a shortage specialty, and there's just too few of us to see all the people who need that kind of help. And secondarily, as I think maybe you're hinting a little bit, there's a lot of people who just would prefer not to see any of us and would prefer to just see their primary care physician. But even though they're prescribing the vast majority of the medicines, studies show when it comes to accuracy of diagnosis, it's not quite there. And I've seen this a lot myself, people who've seen a primary care physician prior to seeing me and tried several different medications, not do well, then come see me, and we go over their history of symptoms, and I do a thorough diagnostic evaluation on everyone I see, no matter what diagnostic impression their previous doctors have given them. And the most common thing that I see is that primary care physicians will misdiagnose an anxiety disorder as depression. And that may not sound like an important distinction, but they're very different illnesses. I get this question a lot, well, isn't anxiety similar to depression? Don't they occur together a lot? And they sometimes do, but they're very distinct disorders. So bottom line is, while I think it's possible to get an accurate mental health diagnosis from a primary care clinician, it is more difficult. There is more room for error. Rating scales would make it more accurate. So I hope that helps and hope that answered your question.
Yeah, it absolutely did. You know, this is the reason why more people should tune into the shows that you're doing, because you take the time out to help people out like me, and I do appreciate that, Doctor.
Well, you're very, very welcome, Donald. And I really, really appreciate the fact that you listen to the show, the podcast, you're listening tonight. That's really great. Thank you very, very much. Really appreciate that.
Yeah, Donald, thank you for your call. We appreciate it. And again, you know, getting back to what Donald was talking about, and really what you were explaining there too, you know, by you know, people, you don't really want to go to your ENT to get diagnosed, or your dentist for that matter. But the fact that there aren't as many psychiatrists, as you've mentioned in the past as well, to kind of see the people that need that help. And I think in that respect, do you think because there is so many people being prescribed medicine, they've kind of lowered the bar, so to speak? Some of these doctors have kind of just been like, okay, yeah, I know what this is, here you go. And they kind of just throw it to the side?
Yes, I do think there is some of that. I think when primary care physicians see someone with a lot of symptoms, complaints, physical symptoms, but their lab reports and x-rays and everything else show there's nothing wrong, they assume it must be depression, give them an antidepressant without taking the time to thoroughly diagnose what's wrong. It is very true that in a primary care setting, and this has also been studied extensively, when someone comes there, they're not going to come right out and complain to their primary care doctor, I'm depressed, I'm anxious. Instead, they're going to focus on other symptoms, physical symptoms, trouble sleeping being the most common thing, or just kind of general diffuse aches and pains. So the primary care physicians are correct in realizing that the person who is having these complaints for which there is no objective physical evidence are having some sort of mental health problem. But it isn't necessarily depression. It could be anxiety, and it isn't always necessary that they might need medication. It could be they just need to go see a therapist and talk through their problems and work things out. So I think there is that tendency. But I also want to point out, because another one of these myths and misconceptions and stereotypes is that doctors prescribe too many antidepressants. So while, to your point, yes, there is a tendency in primary care to just be quick with the prescription pad and not really take the time to thoroughly explore what's wrong or not, other researchers found that there are too many people who do suffer from severe depression and or anxiety who never get medication who need it. So while there are some settings where it's excessive and too quick to do it, there are many, many people who suffer a lot who don't get medication and need it.
And maybe because they're not going to see their doctor. They figure, you know what, maybe I'm just a boring person. Maybe I just don't have a lot of friends because I'm a jerk, and I don't really need medication for being a jerk. You know, it's one of those things where, again, the people that might need the help don't realize that they need the help.
People need to be encouraged to seek help. And also, again, to get back to the stigma thing, there are people who just don't want to come see a psychiatrist, and that's why they hope and want their primary care physician to take care of the issues.
Well, you know what? That just about puts a wrap on today's show, Doc. Unfortunately, we're just about out of time. But I do want to remind everybody that you can go and check out Dr. Scot's website, nfbhc.com. That's North Fulton Behavioral Health Center. That's where he's based out of, in Roswell, Georgia. nfbhc.com is the website. Or if you want to contact him directly, that'd probably be your best bet, 678-822-0250. You can contact him, ask him any questions. Like he says, he's very open to, you know, even just a phone call or maybe a quick email. You can get all that information on his website, nfbhc.com. And as always, Dr. Scott, thank you once again for joining us here today. We appreciate it.
You're welcome. It was great. It's very gratifying to interact with the listeners and the people who called, got their question answered, And when I'm able to answer someone's question, give them the information they wanted, and they're saying that they appreciate it, that they learned something, that they felt like it was helpful, that really gives me a great feeling. That's what all of this is about, and I really enjoyed it. So thanks to everyone who listened and called, and thanks to everyone who watched this video as well.
All right. Well, great. And thank you again for the education, as always.